Good morning, everyone, and to our colleagues who are joining us from Africa, good afternoon. My name is Amy Conger. I'm the Managing Director of our Center for Global Health Equity here at the University of Michigan. And on behalf of our team, welcome to our March seminar, Approach Matters, Community-Driven Research as a Path to Health Equity. This session is part of a broader series for the academic year under the guiding theme of framing our commitment to equity in global health. We are delighted to have guest experts from Gabon and Kenya, along with their research collaborators. And we are grateful to Professor Gary Harper, who has agreed to facilitate today's conversation. And Gary, I'll turn it over to you to introduce our guests and get things started.
Great, thank you very much. So again, good morning, good afternoon, good evening, no matter where you are in the world. We're really happy to have you here, and it's great to see a number of people joining us today. I think we're all of us who do this type of work are very excited, and we really thank the Center for the opportunity to have this discussion today. We have two different teams that will be talking about the community-driven work that they're doing. I'm going to give a short introduction and talk some about community-driven research, and then we'll go to the teams. We are having some challenges with our global partners, as those of you who do global work know that they are also often engaged in a variety of activities in their home country. And so sometimes with time differences and things like that, we have challenges. So hopefully they'll all be able to join us, but if not, we do have our collaborators here. So one of the teams we'll hear from, we'll be hearing from Caroline Rucah in Kenya, and she'll be speaking in collaboration with Laura Jadwin-Cakmak, who is from U of M here, and they'll talk about their collaborative participatory work. And then we have Adélaïde, Nieguitsila, and Rebecca Hardin, who will also be speaking about research they've been doing in Gabon. So I'm really excited that we have this team. Let's go to the next slide, and I want to spend just a couple of minutes talking about community-driven research. And this graphic is from adapted from the Detroit Urban Research Center and also Harvard Clinical and Translational Sciences Center. So I want to give recognition for that. But what this really shows us is that when we're talking about community-driven research, there really is a spectrum. And I think that one thing that we've seen is that there is a greater awareness of the need to incorporate community members and community organizations and community voices into our research, but this is done in a lot of different ways. And one of the reasons why I'm really excited about this discussion today is that I think sometimes some of the approaches that are taken can actually have negative effects if not done in a way that truly represents the voice of the community. And so we will talk about some of those issues throughout the day. So some of the issues we want to think about when we're thinking about the role of community and community members in our research is the first is about power and control. So what degree of power and control do community members have? Some folks in their research have representation, and really there's no power and no control. So it's more, I would say in some places, a degree of tokenism, where people say, oh, we have the community here, but they really don't have any power and control. The next issue is about responsibility and ownership. We want to make sure that we are developing and delivering, executing, analyzing, and disseminating research where people in the community, people that are most impacted, have an ownership, that this is research that they are part of, that they have ownership over, and that they have responsibility for different aspects of the project so that it's true collaboration, true participation. Which leads us to the next point about participation. At what level and how are community members participating in this research project? Is it just a community advisory board that they come to every quarter, or are they actually engaged in the whole process of formulating research questions, developing research methods, things such as that. And then the last thing is decision-making and influence. And I think one thing that a lot of us who conduct global research are aware of, and really even domestic research as well, is that there's often a power differential between researchers who typically are coming in with grant funding, are coming in oftentimes with more advanced degrees, which in the academic institution are, I think, held in high esteem. And I think that sometimes community members may feel that they don't have as much power, going back to the first point. And the thing is that in academic institutions, we really privilege and preference traditional forms of knowledge. So degrees, positions. And I don't think we spend enough time really privileging lived knowledge, lived experience in communities. So with the last point there, when we're talking about decision-making and influence, we have to actively work to break down some of those power differentials so that people will feel comfortable making decisions, and we will set things up in such a way that the decision-making process can be more equitable and can be something that community members can truly engage in, not just representation, but true participation. So that leads us to the spectrum you see there. So on the low end, we have investigator-driven research. So this is totally driven by the investigators. Community members often don't have much say at all. Then we might have community-placed or based research. And in this type of research, we're still, the investigator is still pretty much driving most aspects of the research process, but it's placed in a community setting. And this is something that sometimes people will say, oh, well, this is a community-based project. But if we still look at the different factors I just talked about power and control, responsibility, participation, a lot of those still all are with the researcher, not with the community. Then the next is community engaged. So at this, we have some level of engagement with the community. Sometimes that engagement is minimal, sometimes it's a bit more, but there's some level or some attempt to engage. The next is community-based participatory research. And so a lot of folks, I think, have heard of this. We often refer to it as CBPR. We have a lot of experts here at the University of Michigan in this area. And so with community-based participatory research, there is a much higher level of engagement, sharing of power, sharing responsibility, having participation, sharing decision-making. And I think one thing that's important to think about when we talk about things like CBPR, community-based participatory research, is that it's not a specific method. It's really an approach to doing research. And so I know Barbara Israel, who has been one of the champions of this approach, has talked about that it's about principles. So there's principles of CBPR, and it's about incorporating those principles of how we do research into our projects. So it isn't kind of a laid out step, do step one, step two, but it's really about, again, the approach. And then the highest level is really community-driven research and participatory action research, or what some people call PAR. And with community-driven research and participatory action research, really the community asks the questions. The community generates the questions and then works actively with the research to address those questions. Another thing about particularly PAR approaches is that there is this process of action. So we often in PAR talk about doing research in a cycle. So we generate ideas, we conduct the research, and then we take action to take our data and make sure that those data are being used for some type of social change. And then that whole process continues. So that just, we wanted to set up this idea of the spectrum of community involvement and participatory approaches. Hopefully that all makes sense. I'm gonna turn it over to our first team to talk to us for about 15 minutes. So this will be Caroline Rucah and Laura Jadwin-Cakmak. And then we'll transition to the next team, and then we'll have some question and answer and open discussion. So I'll turn it over to Laura.
Yeah, and so unfortunately, Rucah is having technical difficulties and trying to join, but her links are not working. So Christina has been sending extra thank you. So we're trying to get Rucah on here with us, but our portion today, we wanted to talk to you about our partnership focusing on LBQT women's empowerment in Western Kenya. And so I'm Laura Jadwin-Cakmak. I use she, her pronouns, and I'm the research director for the Resilience and Resistance Collective at the University of Michigan School of Public Health. Hopefully my esteemed colleague will join soon and be able to introduce herself as well. But Caroline Rucah, who uses she and they pronouns, is the executive director of the Western Kenya LBQT Feminist Forum, or WeClif. So WeClif is an organization that really has a mission to build an intersectional feminist movement that will enable women to participate in decision-making, social and economic engagement, and really with a vision of creating an inclusive society where all persons have equitable opportunities for access. And you might have noticed that WeClif tends to use women written WOMXN, and they do that to purposefully be inclusive of folks who are trans and non-binary within the cultural conceptualization of women, and to be as inclusive as possible. And they really focus on advocacy. They have programming related to mental health and really efforts towards inclusive healthcare that serves women, including sexual and gender minority women, and also efforts related to ending gender-based violence. So a little bit about the history of our partnership, and I should say that, Rucah and I were planning to present this together, but we're just two of the many, both community-based and academic partners that are a part of this work. And so really, I would say the history of this partnership predates my involvement and goes back, I think, about 13 years now, and Gary started doing work in Kisumu and just kind of building those relationships with local LGBTQI community organizations. And so that really took place a lot of community conversations over many years. And this, these activities that I'm sharing are not the start of that, but really after collaborating, really what kept coming up in these conversations were the needs related to mental health and well-being and how much of a gap there was there, as well as the fact that most of the research within the LGBTQI community in Western Kenya was focused on gay and bisexual men and wasn't inclusive of the rest of the community. And so we started off with trainings for staff on trauma and trauma-informed approaches, which you can see in these first couple of photos. And then that led us together to work on a mixed methods mental health needs assessment. And so that was really Gary and I and students at the University of Michigan working with Rucah and other members of the organization, really to help them do a needs assessment so that they were able to kind of understand the scope of the problem. And then we followed that up with a series of focus groups to really understand the needs. This is one paper that we've recently published together from that needs assessment that we were able to kind of go back and do a secondary data analysis that would be for research purposes. And so, yeah, and then that really led us to, okay, we know the scope of the problem and we need to take action. And so we helped, Nyarwek was the organization that Rucah was at that time and that we were doing this work with. And we really helped them build a program that it would be a peer-led program to support mental health. And this was done actually without grant funding, but just when we were able to get over to Kisumu with travel funds from other grants and just knowing that this was a real community need and able to do a lot of it together virtually, even before the pandemic, amazingly. And so these are the pictures from some of our trainings for that program. And then that really, oh yes, and I think a really big and important part of longstanding building these relationships and having this community partnership really comes down to both balancing that hard work and then also fun, doing some relationship building. We always go out for kuku choma, grilled chicken, and have our favorite spots when we're together. And then this is all really leading us to our ongoing study that we have right now that's funded by the Center for Global Health Equity about cultural conceptualizations of empowerment among lesbian, bisexual, queer, and trans women in Western Kenya, a participatory approach to survey measure development. As wonderful as that name is, our team did come up with a shorter study name. So we are the Empowerment for Us by Us study, or Empowerment for You Be You. And this will include data collection. We'll do phase one will be in-depth interviews to really do some qualitative inquiry to understand those cultural conceptualizations. And what empowerment looks like in the lives of LBQT women in Western Kenya and how that's related to health. And we'll actually use those findings to develop a multidimensional survey, survey measure. And then in phase two, we'll be able to scale that up and do a quantitative survey across Western Kenya with LBQT women. Yeah, so this next part we have planned, and I did just get a message from Rucah. I'm not sure, but she is still not able to join. So I might do something a little different and ask Gary if you would be able to talk with me a little bit, because Rucah and I had just planned to have this conversation, but luckily I've got another team member here. Yeah, and so, when I guess, yeah, in our work, Gary, how have you seen the process of community-driven research as critical for achieving health equity? Not to put you on the spot.
Not at all. I love being put on the spot. No, I'm really excited that we're able to talk about this today and be part of this conversation. And I do think that one of the really important things about the work that we've done and community-driven research is about listening. And I'm glad, Laura, you brought up the whole issue of kind of the social aspect, because when we're working in and with and for different communities, we need to embed ourselves in the communities. We need to become part of the community. So, with places like Kisumu, I've been working in Kisumu for, like Laura said, about 13 plus years. And so a lot of the ideas, like this current study we're doing, is something that's been brewing for a number of years and has really came out of conversations around puguchoma on a Friday night, or having fresh fish at Lake Victoria and talking about different issues. And so I think that, to me, one of the best things we need to do as researchers is listen, because in order for it to really be community driven, we have to break down those barriers and that hierarchy and that power differential, and not just listen to people telling us what they think we want to hear, but getting to know and getting connected and becoming so much a part of the community that they can share more honestly and openly about what folks really need. So I think that's an important point. And if we really want to reach health equity is about addressing power differentials. It's about addressing oppression and marginalization. And if we're perpetuating those forms of oppression and power through our partnerships, then we really can't ever reach health equity. So I think to truly reach health equity, we have to have community-driven research. It's got to be people who are living experiences talking about it.
Yeah, and one thing that just kind of like sticks out. So I mentioned like this amazing project that we have going on right now with the Center for Global Health Equity. And this is, the first funded project we have been able to do with LGBTQ communities in Western Kenya that is really focused on the needs of women. And that's because a lot of the funding and research with this community has really been from HIV funding. And so that a lot of the research and programming is targeted towards gay and bisexual men and other men who have sex with men, and not really including the rest of the community. And so then when LBQ women are being consistently left out of the research, that doesn't mean that they're not experiencing health inequities, but that's not documented, and funders are not focusing dollars in those areas. And so, that's one of the things that I'm really proud of us in really kind of sticking with the team and doing this technical assistance and kind of making do with what we could when we didn't have funding, and then looking out for those potentially, non-traditional sources of funding. It's not an NIH grant, of course, but really amazing support and support through the process to be able to engage in this community-driven work. Yeah.
And if I could jump in, Laura, I think that's a really excellent point for folks who want to do community-driven research is that those relationships are critical and those relationships are important, and those relationships need to extend beyond funding. So sometimes you need to be really creative in how you continue. So as researchers, we shouldn't just be zooming into communities when we have funding, and then when we don't, we zoom out. And I think the continual process of as one of our colleagues, Rucah and Miko, talks about capacity sharing. So us learning from our communities and our communities learning from us and sharing different forms of capacity. And that's a really great way. So even, when we haven't had funding, we've been able to do workshops and to help build people's skill sets, so that when we do get funding, such as, with the current project, that people are ready to be active participants in the process.
Are we at time? I just want to check in because I feel like
we're getting pretty close. So
okay.
Any final words before we hand it over to our next team?
Yeah, I think, well, I'm gonna save it for the discussion.
Okay.
But yeah, so I just want to say thank you so much. Here is contact information if you want to reach out to us. And I'm still messaging with Rucah, so we'll see if she's potentially able to figure things out by the time we get to our Q&A. So thank you.
Thank you very much, and hopefully we'll be able to hear from Rucah. So I'm going to turn it over to Rebecca and Adélaïde for our next partnership and to learn about their incredible work in Gabon.
Thank you so much, both Laura and Gary. You've given me a lot of food for thought, and I think this will be a really interesting dialogue across projects. And so I'm really excited to be here this morning. I know that Adélaïde, in her capacity as biology professor, microbiologist, and also administrator at the University of Science and Technology in Masuku, Gabon, is having some unexpected student crises to solve today, and is hoping to jump in for the conversations that we might have later as well, but has deputized me to capture what I can of our work together. And so I'll go ahead and share my screen for this presentation, and I will enter presentation mode. I should say that I originally put these slides together thinking about the need to sort of position myself in relation to Adélaïde. I'll try to skew that a little more toward our collaborations as we go. My name is Rebecca Hardin, and I'm a faculty member at the University of Michigan School for Environment and Sustainability here at Ann Arbor. And I'm really grateful to be working in that capacity as one of the only anthropologists on our faculty. And so I bring a lot of historical and environmental and cultural anthropological skills, medical anthropological skills, educational anthropology to collaborative teams across that school, and indeed increasingly with colleagues in engineering and medicine and public health at the University of Michigan, nursing. So I'm speaking from the vantage point of someone who's been a little transgressive in terms of my discipline of training. I've never been an anthropologist, even from the beginning of my work, which was early on. My dissertation work was in the Central African Republic in equatorial French-speaking Africa. And I started out really fascinated by the tensions between what I saw as extremely knowledgeable forest experts. And this is to your point, Gary, about lived knowledge, non-specialist expertise, maybe non-expert specialization. What do we call it? Like, I don't know that I wanted, as a feminist, we know that the personal is political, that the lived is expert, but it's hard to find the words to convey how much the people who are called pygmies in the Central African Republic, forest foragers, how much they know about phenology, about medicinal plants, about chemistry, about interspecies interaction, about histories of watersheds and climatological trends and patterns. I mean, they are experts. And I am continually interested in, and we'll come back around at the end of the presentation, to how I believe we can build better tools for this very volatile time that can capture those modes of knowledge better and honor them better in our policymaking and research work. So from the beginning of my work, however, I was, as a cultural anthropologist, a little bit of an outlier. I kept collaborating with biological anthropologists and others to do cross-subfield studies. I was really interested in how listening to histories and stories and living with people in their worlds in the forests could inform the kinds of transects and spatial monitoring tools that I saw my conservationist and biological anthropologist colleagues doing. And so my early work really looked at trying to get a handle on, as this previous slide mentioned, what was subsistence forest use among these groups? How did they interact with other groups, like more formally educated citizens of their same country? And I think those distinctions, Gary, and our audience are so interesting to me, like both here in Michigan and in the US, where we have significant anti-intellectual tensions right now. Where do we see the differences between that lived knowledge or that non-expert specialized knowledge rubbing up against and shedding sparks with the formally educated knowledge that's privileged, as you say? And so I've been interested in those interactions, and the Central African Republic taught me a lot. I had to first kind of learn to say anything or know anything about those subsistence economies. So I'm very grateful to my colleague, Melissa Remus, and others, Lee White. Transect methods helped me understand empirical methods for understanding resource use. And indeed, if you look at the publications of Remus and her team, there's a terrible story unfolding there of malnutrition, indeed starvation. A lot of the women and families that we worked with in the 90s in these forests have suffered anemia and BMI decline as forest policies and development policies have failed to safeguard their food systems and their knowledge and their rights. So this is not merely academic. I went on after that first project to work in South Africa with a linguistic anthropologist who was interested in the politics of traditional governance. And here I was asking myself, or starting to ask myself more about, well, if big governments and NGOs like the World Wildlife Fund in my Central African Republic field sites weren't doing a very good job protecting people's rights, could traditionally governed communities do better? And this one, the Royal Bafokeng Nation in South Africa, was uniquely positioned because they had secured land rights to pasture land under colonial missionary relationships. And despite having been exiled by an apartheid government, had returned and claimed that land only to discover that one of the world's largest platinum veins was just underneath it. So they're very wealthy and you might think fortunate example of community governance, but the tensions that come with the mining economy, and as you all know in the health field, the medical catastrophes that come with a mining economy in South Africa have weighed heavily upon them. Finally, after that, I worked with the Graham Institute here at the University of Michigan for several years, and with my colleague Joe Eisenberg in public health, to do field courses in mixing natural and social science methods in Kenya. And this was a really interesting time to be in Kenya. We actually landed in Kenya in 2010 with a group of 6 or 7 master's students and 15 undergraduates on the night they ratified a new constitution. And in the wake of Kenya's violence after the 2008 elections, there was a lot of nervousness. And I do want to say at this juncture, go blue, because our community, the parents of those students, the faculty involved, the amount of faith they placed in our Africanists here at Michigan to say, no, Kenya's going to be okay. They're going to ratify this constitution. There's not going to be violence. There's going to be dancing in the streets. Go ahead. Meanwhile, my multi and bilateral colleagues, the World Bank, my NGO colleagues, they were all canceling conferences left, right, and center. Everyone was repositioning their meetings that week for Uganda or elsewhere because they were worried, right? Michigan landed and we had an amazing time establishing what became a multi-year educational program, subsequently led by my colleague Omolade Adunbi and Bilal Butt, for field learning in Kenya about the interpenetrating questions of human health, economic development, and the tensions, as you can see here, my daughter with these roses grown as cash crops in this arid ecosystem. We really were looking at different kinds of ranches, commercial, mixed, and community or group ranches, as they were competing for water and other resources with cash produce of flowers and vegetables for European markets. And this just points, I think, in some ways to how hard it is now to think about community without positioning community in the context of capitalist markets and economic development and the inequities that come along with some of that. So backing up from my own good fortune at having had the privilege to be a Peace Corps volunteer in my 20s, and then to clamber onto a PhD program that funded my return to the African continent and into, in fact, a secure academic job. All of these things, super contingent good luck. And also being one of the only Americans on the job market who had ever spent many years in the Central African Republic speaking French, right? That didn't hurt. But I had the good fortune to see many different sites and to learn from many different non-expert specialists in African landscapes. So I really need to thank those teachers in this talk today. And I need to tell you a little of what they've taught me about communities. Communities have not been in isolation. They are not strangers to commercialization. This is a map that the Royal Bafokeng used for their own planning in their atlas. And it shows 2 of the field sites where I've worked historically and how historically and even prehistorically enormous amounts of trade and interaction with other African peoples and beyond have happened in these regions. So although they feel like sort of the white spot on the map, the Kalahari, the Bushmen, the forests of the Congo, the Pygmies, they're the peoples we like to hold up as pure primitives, if you will. But they aren't. They are incredibly cosmopolitan peoples struggling to retain traditions of mobility and subsistence in the face of often very uneven playing fields for commercialization and development. So what has this taught me about defining community? Basic sociological definitions of community have to do with them being small, spatial, stable units, intimate, people who live together, that sort of thing. And I don't mind those definitions. In fact, in many ways, I have been in places both where I grew up in Tennessee, here in Michigan, and on the African continent, where that definition is surprisingly relevant still. But there are also emerging definitions of communities that we have to think about in our work that have to do with shared common interests, internalized norms, roles and behaviors, networks, right, that are non-spatial or not only spatial, that are much more complex. And I'm really curious about how we can do justice to the combinations of those more old school and emerging kinds of communities in our work. That seems to me really important. The other thing I want to really lean on, and this Laura's talk was so great, I want to thank your project for thinking with us. This has been something Kathy Cohen, who's a political scientist at the University of Chicago now, but who was my colleague earlier in my career when both of us were in New Haven, Connecticut, has a really concise definition from the wonderful book, Boundaries of Blackness, which looks at LGBTQ experiences within marginalized African-American communities in the US. And Kathy defines a group as marginal to the extent that its members have historically been and continue to be denied access to dominant decision-making processes. And this is both, as Gary notes, within the research process and more broadly in society, right? To what extent are they stigmatized and so on, isolated, segregated, excluded from control over their resources? I like that definition so much. And I also like the way Kathy defines and explores what marginalization within a marginalized community looks and feels like if you are not corresponding with that. Marginalized groups need to fiercely define and defend itself as part of a norm, right? So I think this question of attending to both the nestedness of communities and their vulnerability to environmental justice and economic stressors, but also their internal fault lines, it's a big job. And I think, Laura, I mean, I think this question you guys raised of not just going in when you have funding, but staying engaged, because those internal fault lines and those external pressures don't stop, right? Some of my work in the environmental justice field of specialization at UNC's, or School for Environment and Sustainability, has looked at how the environmental justice movement has transformed from more grassroots, not in my backyard kinds of very affinity group-based or residential movements to broader networks of expertise and advocacy that span sites that have become formal 501c3s. How does that, professionalization and extension of networks affect their accountability and legitimacy within communities? And I think that work in what we call EJ might be a really relevant point to think across with global health inequities. I am really interested in policy insights by people like Nobel Prize winner Elinor Ostrom. Here again, some photographs from my work in South Africa. And I was trying to use that fieldwork to think about what Ostrom points to as community capabilities to be adaptive and to have control over resources and decisions, and how multiple overlapping institutions that have similar aims strengthen that ability. But these are nested communities within power relations that are much broader. And here you see the football stadium that's been built with mining, football meaning soccer, in South Africa. Mining revenues, in which they hosted the British team for the World Cup, and in which their CEO and chief, Leroux Modotlehi, was enthroned a few years ago. There's a lot of nestedness even within the Royal Bafokeng community in South Africa. I have learned so much about complex notions of community. So when do communities work well? They can work really well in humanitarian disasters. These are photographs from some work in Detroit with blight busters and in Brightmoor, photograph of the Association for the Study of Law, Property, and Society, progressive property lawyers looking to help bolster community rights to housing, clean water, food. We do see communities really come to the fore when there's a medium-term need for care for places or people, in disasters when you need self-sacrifice. But communities don't always work, and here comes Adélaïde, when we have to deal with the complex shelf life of chemical contaminants in groundwater, or the privatization of public goods. It's very hard for local communities to sort of stand up and handle these much more complex order challenges. So this slide is where I'll segue into a little more work that I really am indebted to Adélaïde for facilitating with me, and to other colleagues here at the University of Michigan from the Transforming Learning and Teaching in the Third Century, and also the Grand Challenge, the Grand Challenges Third Century grants, much of which were internal funds. Why is that so important? And why am I here with you at CGHE today? Because there are ways in which the Gabon work couldn't have happened. The innovative work we've done there couldn't have happened without internal funding, the kind that you all are providing now to our partners and teams across the university. The Ford Foundation, USAID, many of the funding agencies that support work in Africa skew in the US toward English-speaking African sites, Uganda, Kenya, South Africa, et cetera, Ghana. For good reason. It's complicated to work in the inner Congo basin and everything's in French. And so it's, these are sites that are incredibly important. Gabon is one of the #1 countries in terms of freshwater repositories for the African continent, as you can see from the middle photo. And I am so proud of Michigan for acknowledging that we as a university must be good global partners to those who are also sitting with substantial freshwater resources in their backyards for human health in the future. We have leveraged teams. You see here myself with colleagues, Brenda Violetal, Johannes Schwank, and Roy Clark in physics and applied physics here at the university. Schwank is a chemical engineer. I'm an anthropologist. This is a wonderful interdisciplinary group that spent many years connecting with colleagues at historically Black colleges and universities like Howard University, Jean-Jacques Tati, and others, but also with universities and other research organizations within Gabon. So here are photographs of us on the banks of a river in Gabon and of our Gabonese colleagues, including Adélaïde in the red scarf, so you can see her smile, even though she may not be here yet, and colleagues from water utilities and research organizations, the National Research Institute, as well as water utilities who have come, and you can see them outside Jenny's farm stand in Dexter. We were visiting Lakeland in Pinckney and really trying to facilitate understandings among different kinds of experts, different kinds of knowledge communities in Gabon and in Michigan about the importance of governance and protection of fresh water for human health. Now, that work is extremely indebted to several of my colleagues across campus. It was partially funded by the Graham Institute, but it has tipped me into a wider research agenda in recent years on distributive justice in access to clean water, which has included investigations in China, here in Michigan, and also in Gabon. And I'm really excited about the way that my early work, pictured here on the banks of the Sangha River in the Central African Republic, has allowed me to learn to listen to communities, but also then to build communities of knowledge that are going to stand up to the challenges freshwater faces in this century and beyond. In Gabon, we centered that work in a very particular location, which most global health professionals might recognize, which is the Nobel Prize-winning Schweitzer Hospital on the banks of one of the largest rivers in Gabon. It is a low-slung, very sustainably designed infrastructure, which includes museums and commemorations of the great Albert Schweitzer. Now, of course, today, although Schweitzer's peace activism and he was such a proponent of care for human and non-human lives, and such an avid practitioner of provision of basic care, maternal and child health care, to those who needed it most in his time, that it seems hard to criticize him. And yet he was also a very colonial phenomenon, the great white doctor, that now has to be reinvented and reconsidered in some ways, I think, for the present. And so one of the things Adélaïde, again, pictured here with myself, students from the USTM, the aforementioned colleagues from Michigan, one of the things that we all did together was to think about how we might redefine places like the Schweitzer Hospital to move into this century with more of an emphasis on inequity and environmental justice and the guarantors of community health that come from stable, protected fresh water supplies and food supplies. That work over several years under the Refresh project in Gabon really brought Adélaïde and myself together and enabled us to build out the water component of a 3-pillar project that had both energy, food, and water elements. You see here pictures of the gardens at the Schweitzer Hospital along the riverbanks that are irrigated through the flows of the river. And I just want to point out that there is a kind of remarkable, we can learn so much, I think, from African landscapes where the clinic or the hospital is a community institution. Enormous amounts of support for families and communities flow through these institutions and knowledge. And I really believe that we can think about, ways in which data and data science and learning about water and water quality can inform food and water and energy choices within clinics and campuses across Africa to really redefine sustainability and environmental health at community scales. So finally, I'll close with where this work is going now. And it has to do with the way that we can create, especially in pandemics when we can't all travel back and forth, the kinds of mobile phone friendly tools to learn and to link experiments in technologies and teaching for community-based experiments in sustainability and health. And that work has really grown out of collaboration across student radio stations in universities here and there, but also in funding and support for students who have moved around, not just between Michigan and Gabon, which has been great. Adélaïde has been here 6 months learning lab techniques and brought students with her. Lutgard Raskin has been a partner in making that happen. We now have students who learned English from Gabon here in Michigan who are studying at the University of Western Cape in South Africa, where there's a significant water center and community-based educational facilities. So that kind of investment in the next generation, I think, is really important. And I'll just close with bringing it right back to Ann Arbor and let you know that as we've developed these tools on the platform learngala.com, which is an open source, open access tool that has been developed with partners in Gabon and Ghana, to share success stories about grounded community-based health and water and energy innovations. We have really connected. This is a photograph of colleagues from China and India and Africa out at the third sister lake on the Saginaw property here in Ann Arbor, where the 1,4-dioxane plume has been a persistent problem for our community. And you see here also a URL that links to a site that has collected, voices of our community here in Ann Arbor in both charrettes and in a case study and in a series of testimonials from different stakeholders and community members in our community. I really believe that community to community partnerships where we let our partners see the complexities of community response in our own communities and we share in theirs is a really important way to build these bridges out. Couldn't have done it without Adélaïde and my colleagues in engineering. I'll stop there for the moment and we can get into some conversations. Thanks for your patience.
Great, thank you very much, Rebecca, that was extremely interesting and giving us a lot to think about. We have about 10 minutes left. Laura, did Rucah ever make it back? Okay. All right, so I think what I'd like to do is first see if there's any questions from participants. Amy, I'm not sure if that's possible. People can submit questions, or but I would like to give the participants an opportunity to ask any questions or points of clarification. So do we have any?
Yeah, Gary, and hello everyone in the audience. The Q&A is open. So if you would like to add your questions there, we'll keep an eye on them for you.
Okay, great. So I think while we're waiting for the questions to rush in, one of the questions I have for our panelists to think about or to share your thoughts on is that, although there's really no kind of like right and wrong way to do this type of really community-driven research, what are some of the ways in which you've maybe seen other colleagues or mistakes that you and your team have made in the past that folks either have done or are doing that can serve to really kind of stop or prohibit this flow of knowledge and research that's really based in the community? I know I wasn't that articulate with that. I apologize for that. So I'm gonna, Laura, Rebecca, any thoughts on, kind of ways where you've seen this not go so well?
Yeah, my mind is really drawn to another study that Gary and I have been working on with gay and bisexual men in Kenya. Right now, we're finishing up a trial of an intervention designed to support HIV prevention through PrEP uptake and adherence, and as well as mental health support. And we kind of came into this space where after there had already really been a lot of studies focusing on PrEP for gay and bisexual men in Kenya. And those initial studies, or some of the studies, were working with local grassroots organizations, but doing so in such a way that there wasn't that communication, there wasn't that shared decision-making. And a lot of what happened and what we found out when we came in for our project and we're doing qualitative interviews across the community was that, you know, those organizations or the funders for those initial projects were really just all about the numbers. And so it wasn't about explaining PrEP, seeing if PrEP is right for you. And I should say PrEP is pre-exposure prophylaxis, or a pill that you can take to prevent HIV for those not in the HIV world. And you know, so really it was just like, come in, get your incentive for participating in the study. They can get their numbers. And then a lot of the participants in these studies were not taking the PrEP at all, which the researchers didn't find out until the very end of the study, when the sample, like actual biomedical confirmation of adherence levels were found. And that really, you know, did a lot of damage in the community around, like, why are they pushing this drug? Who is this coming from? That it actually, I think, interrupted and increased stigma there. And so, you know, we were very cognizant in learning about that and trying to kind of, you know, set a different tone and really work collaboratively with our project, and be okay with, we actually said, you don't have to take PrEP to be in our study at all. We actually just, if you want it, we want to give you information about it, but you don't have to take it. And that piece, I think, is a lot of times said, but not communicated in such a way that people really hear it. And I'll stop rambling at this point, but that was, you know, just such a poignant example that we've seen.
And we have had, Rebecca, if it's okay, we've had 2 questions that have come in since then. Is it okay to throw those out? Okay, great. So we have one, and of course now they're flowing. So from Revea Miko, she says, thank you. Can you all share your thoughts on if and how community action approaches may help decolonize our UMich Global Health Presence project? So Rebecca, do you mind responding to that?
I don't mind at all. And I appreciate the question very much. I have this very strong sense that the decolonization work that's ongoing at my school, we actually have an initiative that's moving course by course, syllabus by syllabus on, including collaborations between students and faculty on the kinds of references and readings we use. And I have to say, like, one of the reasons I have put so much energy into creating the Learn Ghana platform in recent years is that what was happening on radio in Ghana, in Gabon, in Michigan, was exchanges of views by such a wide range of knowledge holders on issues they cared about in a way that I didn't see reflected in all the texts and articles necessarily that are the stock and trade of academic work. So I think creating and tech is not a silver bullet, because tech is can be an incredibly exclusionary field, but making emerging tools inclusive seems important to me, and making them able to capture and convey voices that hold knowledge beyond just the printed page, or, and this, as Laura says, numbers, right? Numeric literacy, literacy in technical terms. I believe we need multimodal, multimedia, accessible tools, and they sometimes have to be asynchronous because, well, look what's happened today with our effort at a synchronous debate. We have different time zones, different tech challenges, different, so to be able to access a platform where, Adélaïde can put a case up that's happening in her field or in her field sites, and have others interact openly without paywalls and barriers, and without having to fear, maybe doing it in a recorded way instead of a typed way, strikes me as really important. And that's one step, is the way we exchange knowledge. The questions Gary raised about who exchanges knowledge and how we convene. And I want to just give a shout out to CGHE for trying this morning to make sure that we don't only foster individual scholarly narratives, that we talk about teams, that we talk about the different kinds of knowledge and work that goes into this, and that we talk about subjugated knowledges. the LGBTQ plus emphasis is so important. The question of female scholars in fields like microbiology, like Adélaïde, her struggles, her roles. These are really important elements, I think, of decolonizing practice. But and just because they don't always go smoothly doesn't mean we don't keep trying and keep working on those issues, acknowledging what colonial legacies have to do with the way fields look and how we can change that is very important. Thanks for the question.
And so we only have 2 minutes left, and now we're getting really great questions that could go on. I know Amy needs about a minute or so at the end. I did want to just very quickly address a question that Matt Bolton put in about for epidemiologists and people that are doing more quantitative work. I mean, yeah, I would say one thing is that by doing community-driven work, it helps us understand what questions we should be asking in those quantitative surveys, also how we should be asking them. Oftentimes when we come in with large epidemiological surveys, if we're asking questions that are not rooted in the lived realities of community, what we do, and this fits in with colonization, issue 2, is that we are simply saying how issues in our realm of the world do or do not play out in another realm of the world. And so, and asking questions is not just about, is it in French or Swahili or English, but the way people conceptualize questions, understand phenomena, all those can be really enhanced by this research. So I'll hand it over to Amy. I'm really sorry, Amy, that it's so short. We have amazing questions left, but hopefully we can continue this conversation elsewhere.
All right, great. Well, thank you, Laura, Rebecca, Gary, for giving us your time today. And also to Caroline and Adélaïde, we know that they put a lot of prep into the presentations, and extend our thanks to them as well. So on that note, we're doing pretty good with time. And thank you again, everyone, for joining us today. And we look forward to seeing you next month.